Hello, I'm Michael Kurer, and I wanted to tell you a little bit about Carpal Tunnel Syndrome and the surgery which is used to treat it. I'm a consultant orthopaedic surgeon and I've been treating this disorder for 20 years or more. So what is Carpal Tunnel Syndrome? And here you can see a diagram. The median nerve which supplies the sensation to the hand runs through the wrist and under this fibrous ligamentous sheath area. And for reasons we don't understand, the ligament gets thickened and starts to squash the nerve there. What symptoms do people report? Well, they report tingling, classically, and they report it in the area supplied by that nerve, which is the thumb, the index, and the middle finger. And they get that tingling during the day, but particularly at night. It can also be associated with night pain. The tingling can even become persistent numbness and even weakness of the hand with people dropping things. So what are the treatments? Well, there are several recognised treatments. The simplest is a thing called a night splint, and I've got one here. And it's a strappy thing like this, which you wear at night. And a lot of people find they get relief from that and it solves the problem. The second recognised treatment is a cortisone injection, and that's given just here at the base of the wrist. It can be done with ultrasound guidance or otherwise. It shouldn't hurt very much. And that can give rise to significant relief of symptoms for many months, 6 months, 9 months. And it can even be repeated, provided the patient has normal function. Finally, the other treatment is surgery. And though no one wants to have an operation, the reason people decide to have it is because it's a cure. It releases the tight nerve and they never get the symptoms again. I'm going to tell you a little bit more about the surgery. The question is, when should you have it? And the answer simply is when you've had enough, when you're sick of having these symptoms. They're annoying, they're frustrating, and you'd rather have a once and for all solution. And perhaps the night splints aren't working well enough, the cortisone injections aren't working. Another reason to have the surgery is if you do get weakness and you do get persistent numbness. The problem is the longer that goes on, the more chance there is of it not recovering after surgery. So weakness or persistent numbness should be treated. And here's a photograph of a gentleman who had persistent weakness of his thumb. You can see the muscles there wasted, and that unfortunately probably would not recover as a result of surgery. And if you've had injections and they're not the solution, then you should have surgery. What does the surgery involve? Well, I mentioned this ligament here which causes the problems, and what we do is make an incision over the ligament and release the ligament, making it open up. And what happens then is it then allows the nerve to breathe, and the ligament then heals but slack, and that's why the symptoms don't come back. The surgery is done under local anaesthetic, and these days there's a sophisticated new form of local anaesthetic which is almost painless to administer and extremely effective. Patients don't have to starve. In the past we used to put a tourniquet on the arm to make the surgery easy, but that's no longer necessary. Operation takes about 30 minutes at the most. I use internal stitches which are self-dissolving and don't have to be removed, and then we put on a bandage to give us a bit of support. The patient goes home half an hour later. The next day I use an accelerated recovery regime. We take off the bandage and wash the hand under a tap, tap water is very, very clean, and then one puts on a new little plaster. I've got one here. We'll just put this new little plaster on the hand like that and start to use the hand. People can use the hand, they can do a button stuff. It's sore, as it would be if you'd fallen over and cut your hand, and it's sore for about 4 days, and then after that people are a huge amount better. What happens next? Well, the first thing people notice is that night, the pain that they used to wake with at night, when they used to sort of shake their hand and have to wake up, has gone. And they don't have it that night, even though obviously they have some soreness from the cut. The tingling usually goes in 2 or 3 weeks, so it can take up to 6 weeks. And if they have numbness or weakness, then that can take weeks or months to recover, and sometimes, depending on how long it's been going on, may not even come back. People also notice scar tenderness. The scar is in the hand and the tenderness lasts up to a month, and people can apply moisturising creams to help alleviate that. One also has to ask what can go wrong with one of these operations, and luckily, I'm pleased to say, not very much can go wrong. It doesn't damage the nerve or cut anything that one shouldn't. The most common complication is that you can get an infection like in any wound, and luckily that is treated very easily with oral antibiotics. The scar tenderness, as I said, that can last for about a month, but will usually go. Very occasionally people get a scarring reaction, which is an idiosyncratic personal thing, and if that happens we give physiotherapy, extra exercises, and it does resolve. And finally, a few patients, despite having the operation, they still have the carpal tunnel syndrome, and that's usually a function of not having it done soon enough. Here's a summary of the expected results if you take 100 patients, and this is in peer-reviewed literature, many studies. Essentially, 95% of them will be absolutely delighted. They're glad they had it done, they would have it done again, and their symptoms are gone. 3% of people get the complications, which I mentioned, the scar tenderness, wound infection, the whole bag of complications, most of which will resolve. And as a general example, a significant number of people having had one site done, because this is often a bilateral disease affecting both hands, will then subsequently come back and have the other one done. I have many patients who've had both sides done. So it's a good operation, and it's a cure usually, almost always, and I'm sure if you have to have it done, you're very pleased you did. Thank you very much.